welcome to the fifth episode of HerHealth series with Aloe. I'm Dr. Lubna Alam, founder of Aloe Enlightened Woman, your host for today on the topic of what multicultural women say about health. We have with us our expert guest, Julia Tran, the Senior Health Promotion Officer from Women's Health Matters. Aloe's aim is to uphold and promote gender equality, women's health and well-being, and leadership and empowerment, specifically within the culturally and linguistically diverse women. Now, women's health matters, right? All too often, though, we ignore symptoms of health risks as we prioritize family, work, social obligation over ours. This month this week we had the Women's Health Week, and October is the Mental Health Month. So we bring you 6 episodes that are critical for women's inclusive health and well-being. In each episode, we bring you access to a health expert where we focus on a health concern that multicultural women are vulnerable to. But today, we kick off with findings from a survey that was conducted by Women's Health Matters on multicultural women's health. And yes, you can start to ask questions now on Facebook Live using the comments feature, or also in YouTube as well using the comments feature as well. And if you like to be anonymous, please feel free to send us email to our email address aloeenlightenedwoman@gmail.com. We will try to make sure we answer all your questions that you have. Today, I want to now introduce you to our expert guest, Julia Tran, who is the Health Promotion Officer at Women Health Matter. And she was also the lead, if you like, of the Women's Health Survey that was run by Women's Health Matters. How are you today, Julia?
I'm great, thank you. Thank you for inviting me to this episode today.
Thank you for being here. Now, tell us about the survey, multicultural survey that the Women Health Matter ran. What was the purpose of the survey? How many women participated? And how did you reach these women?
Thank you. So we started off with the survey because we had been going into some consultation and reference groups with multicultural groups, with the Canberra Multicultural Forum. And we also looked back at our history and realized that we hadn't done any sociological research specifically targeting multicultural women in a decade. So that's why in early 2021, we had this online survey targeting multicultural women to reach out to see what accessing services in the ACT was like for them, what it meant for them regarding what health meant. And yeah, being able to compare multicultural women as a group with general population of women in ACT, with women who identified as LGBTIQ, so yeah, we have different priority groups that we have been researching on. And it was just time to be targeting a huge population that is multicultural women.
Excellent.
Yeah.
So if you could tell us, what were the top health risk or, issues or topics that was raised by these women?
Yes, so we had a multiple choice out there to see what women would select. And the top 3 that were identified by the women, top being weight, diet, and fitness, was the highest concern, which were found by 66% of the women. We had a total, 66% of 218 women that answered the survey. So and then the second one was regarding sleep, fatigue, and energy. And then third being mental health issues. So that was almost 60% of the women suggesting mental health was one of their concerns.
Yes. Excellent. What are some of the other issues that were raised other than these ones that you mentioned?
Yep. So other major ones that were identified were pain and chronic pain, as so that was about 26%. Um, Other women described that sexual and reproductive health was also concerning to them, as well as chronic disease. So that made up for a total of the top six of the issues, um, which I guess throughout this Her Health series, we'd like to go through topic by topic.
Excellent. Um, so, um, so what are some of the typical barriers or obstacles, mentioned by multicultural women, as in terms of their accessing health services or in terms of health information, etc.?
Yes, so women from multicultural background in the ACT, they mentioned a lot of different type of barriers, um, such as having a poor experience regarding the ability to access health. And they further elaborated on these experiences by saying, some people saying the appointments or the services have not been convenient. They've had a lack of trust in the health professionals they've trying to reach. The another point of not convenience is the wait times being too long, not being able to seek out their healthcare on time. But a huge one was affordability, whether with already ACT Health being one of the lowest bulk billing cities in Australia, affordability is mainstream across different priority groups in the ACT as well as the general population. The women in the study also describe navigation, which is defined as being able to know where to go to seek out support services regarding what they need for their own healthcare. Now, there were also specific barriers that would relate to women with multicultural backgrounds. So we call this intersectional care, such as their experiences of marginalization because they might be single parents, or that they have a chronic illness, or they're currently receiving mental health or government housing and welfare. And that just shows to the increased caring responsibilities they have as women, for their children, their dependents, as well as their partners and elders. Now we've got many more barriers, but happy to speak to about more of them without further questions as well.
Yeah. So I guess one of the things that I'm thinking, while listening to you is that do you observe any differences, between multicultural women and general population, in terms of how they access health services or information? And
Yes, so
so let's say, for example, what services they're more likely to access or not access.
all right, thank you. So when we compare the multicultural women population versus our previous studies on general population of women in the ACT, we found that multicultural women were more likely to access specialist doctors as well as the walk-in centres. Unfortunately, we haven't found out why, but maybe because affordability or having to reach care at a later stage. But what we also found interesting is what they're less likely to access for as well. So they were less likely to access healthcare regarding their dental care, filling a prescription, and going to the emergency department. And so this might relate to, our previous barriers that are linked to multicultural women. For example, that whether they are getting culturally appropriate care, or whether they have access to health services regarding their eligibility with Medicare.
Excellent. Did you observe any other differences in terms of health services, accessing health services in terms of, especially I think sexual and reproductive services, because that is probably something that multicultural women are not, are usually open to, if you like, to discuss with other people.
Yes, so we actually found that there was a similar rate between general population and multicultural women regarding their access to sexual and reproductive health services. However, what was really interesting after seeing that rate, we did see that women identifying with a multicultural background said reproductive sexual health was a lower priority to them. And we're not sure why, but it's possibly due to the lack of awareness regarding sexually transmissible infections testing. So that is STI testing, as well as how regular you need a cervical screening, or whether, as we found out earlier, whether they know how to access those services at an affordable manner as well.
Excellent. What about, Julia, access to health information? Did you observe any differences there?
Yes, so with health information, we found out that in general, multicultural women were most likely to trust information from their doctors, whereas for the general population, they sought out information, number one, from online sources. Now, which is a flip between multicultural women and the general population. And whereas number three was ranked equally between two populations, which is seeking information from their own friends. Now, we can suspect that with online information, a huge amount of that information requires quite fluency in English language, English literacy, as well as some form of medical literacy. And if that can't be translated by someone who has English as an additional language or not as fluent in English, we can see why they might prefer accessing information directly from a health professional like a doctor or their own GP.
Yeah, I mean, interestingly, Halo participated in one of the focus groups, run by Women's Health Matter, and we were trying to access community from Bangladesh and South Asian women. And interestingly, the language barrier definitely came up as one big thing, because one of the participants said that her grandmother was, ill in the hospital, and she felt that if her grandmother knew English, she would have got better service. So obviously, language is one of the key concerns, I think, when it comes to accessing health information and services. So that's excellent. So Julia, if I may ask, like, if I ask you to, let's say, yeah, I know that Women's Health Matter have been working with this type of survey, especially women from multicultural backgrounds. If I ask you to summarize what takeaways for you from this survey, because I understand you analyze the data, right? So if I ask you, tell me three big things that we can take away and we can give it to the policymakers, if you like, the health professionals, as an advice to when they're, servicing, multicultural women.
First of all, most importantly, is appropriate care, and that means culturally appropriate care that answers to the great cultural diversity of Canberra women. So that means not just having language support in the services and in the information, but also health professionals treating their patients with utmost care and um, centering the care around what the needs are of the patient. Now yeah, and I'd like to emphasize
Yes.
that the women from the study um, would benefit from improved care regarding reproductive sexual health as well as mental health, because those are the two big subject matters in women's health that are highly still stigmatized already in the general population, but even more so in a multicultural population.
Yeah, that's an
Um,
excellent
yeah,
summary in that, in that one. But yeah, go ahead, Julia, finish it.
yeah, and so that means also being able to inform women how to find accurate and appropriate information. So the capacity building um, is provided to the women as well. So we've got training for health professionals as well as training for the patients so that they are empowered to seek out their own care.
Excellent. Now, I know that we have used this survey, so thanks to Julia for helping Alo with this. When we were trying to decide the episodes for 2022 for our, Our Health series, so we reached out to Women's Health Matter and Jan. We sat down and we decided on the topics, right? For the next
Mhm.
5 episodes that you will see also, in Facebook and YouTube. And the recordings, note that please, these recordings of these videos will be made available afterwards, so you can watch them later as well. So tell us, Juliet, let's share with the audience here, how did we come up with the 5 topics that we decided? And how has this information, because it is informed through the survey, isn't it?
Yes, absolutely. Yeah, thanks for consulting with us because it's about, after all, filling in the information gap that women, multicultural women, would benefit. So we were definitely guided by what were the top issues, health issues that the women from the survey responded to. And yeah, we also had a huge question regarding what health means to them. So we had a huge, like, overwhelming answer regarding that health meant both physical and mental health. So we want to be able to cover in this very short series that realm of subjects, and that includes weight, diet, and fitness. So being able to eat well, being able to sleep well, being able to exercise well, but also mental health. Now, mental health can be individually of the women, but also the fact that they play huge caring roles for their family. It's also mental health of their children, um, whether they're young or adolescent, or any other family members that they care for. We also want to stress the importance of regular testing regarding reproductive sexual health, regardless of what their sexuality is and what their whether what their status is. So because regular testing is what is required, not because how sexually active they are in that current time. Um, and then we want to be able to inform about how to um, navigate the health system in the ACT. That way they can seek out their own information and services for themselves, their family, and their friends.
Excellent. Yeah, and I think we have already got secured, experts for all those sessions. And as you can see on the screen, the episodes, are being advertised. So if you follow Alo on our Facebook page, or if you subscribe to our newsletter, we will be sending you more information, when these episodes are running. And always you will be able to access these recordings of these from our YouTube channel, Facebook, and as well as our webpage, allowoman.com. Now, Julia, there are, we had some technical issues, so we were not actually live in the Facebook. We were live in YouTube, but let's say there are a couple of questions still from the audience in terms of one question is that we received through email is that how does these findings, if you like, inform policy? What have you been doing? What Women's Health Matter is doing with this findings? How do they inform the government?
So we, as a think tank and as a health promotion research center, we come in with this information to advocate with our findings to ministers regarding what changes can be made. Now, this could be whether the ministers ask us or that we inform the ministers. We also provide this information to the Office for Women so that there is improved care when it comes to women from multicultural backgrounds. And it's specifically important to also be able to establish networks with multicultural communities in the ACT so that we can continue this type of research and continue to advocate for improved healthcare.
Excellent. And I think there is one last question that I wanted to ask you today is where to from here? What are you doing next? What's your next plan to help multicultural women?
Yep. Thank you. So first off, get this report published by the end of the year. And then be able to use that, as we said earlier, to advocate for changes and keep working with Allo, for example, on these wonderful health promotion opportunities like this series, for example, regarding being able to inform the multicultural community as well as higher level policy changes as well, because we're able to use these findings for a couple of years before we try to do the research again to see if anything has changed and what other
Excellent.
gaps again to be filled.
Thank you, Julia, for your time again today. I think we will wrap up as there are no more questions from the audience. And but I hope this is just a beginning of a discussion for multicultural women's health, their concerns, issues, and barriers that you have presented to us. I hope this session, this series and episodes, if you like, initiatives like this will foster a network for women to communicate their health concerns with, their peers and, of course, their health professionals. If you still have any questions, feel free to send them to Allo, and we will get back to each of you. And thank you to the Allo listeners who have joined us today for staying with us, for your questions and support. Please spread the word to your friends, family, and colleague. As I said, this video will be made available to you in 3 platforms, in Facebook, in YouTube, and also on our webpage. So you can access this anytime, afterwards and share with your network as well. So stay tuned to join us live for the next 5 episodes. And Julia, anything, one last word to our audience?
No, thank you for having me this episode, and I really look forward to the next few episodes as well.
Excellent. Thank you very much. So until next time, this is Lubna Alam signing off from Allo team. Bye-bye.
Bye-bye.